Hello, I'm Tiana Avery, and I'm going to go over how the Physical Activity Readiness Questionnaire, or the PAR-Q, can be used in risk stratification. So to get started, let's take a look at the pre-participation health screenings that are in place currently. The purpose of the pre-participation health appraisal screening process is to identify known diseases and positive risk factors associated with coronary artery disease, assess lifestyle factors that may require special considerations, and identify individuals who may require medical referral before starting an exercise program. Two instruments are commonly used to fulfill these tasks. The PAR-Q, which is the Physical Activity Readiness Questionnaire, consists of self-recall of observations and signs and symptoms experienced by the client, in addition to the confirmation of a diagnosis by a physician, and the Health Medical Questionnaire, that assesses the appropriateness of moderate and vigorous levels of exercise by identifying risk factors present in the prospective client. The 7 identifiable positive coronary risk factors that have a correlation to CAD are age, family history, smoking, hypertension, dyslipidemia, impaired fasting glucose levels, obesity, as well as a sedentary lifestyle. To be considered a positive risk factor, these aspects must meet the following criteria. For age, it is men 45 and older and women 55 and older. A family history of myocardial infarction, coronary revascularization, or sudden death before 55 years of age in the biological father or other male first-degree relatives, or before 65 years of age in the biological mother or other female first-degree relatives. A current smoker or someone who quit within the previous 6 months, or has exposure to environmental tobacco on a regular basis. A sedentary lifestyle consists of no participation of physical activity at least 30 minutes a day and at least 3 days of the week. Obesity is a BMI of 30 or more and/or a waist girth greater than 40 inches for men or 35 inches for women. Hypertension is the systolic blood pressure of 140 or higher and/or a diastolic blood pressure of 90 or more on 2 separate occasions. Continuing with positive risk factors and their defining criteria, we have dyslipidemia, low-density lipoprotein cholesterol greater than or equal to 130, or high-density lipoprotein cholesterol of less than or equal to 40, or a lipid-lowering medication. Fasting plasma glucose of greater than or equal to 100, but less than 126 on 2 separate occasions, also is a positive risk factor. A negative risk factor suggests a favorable influence to the development of a protective cardia benefit. High-density lipoproteins provide a protective mechanism against CAD by removing cholesterol from the body and preventing plaque from forming in the arteries. So having a serum HDL cholesterol of 60 or higher decreases the risk of coronary artery disease. The PAR-Q is useful for referring individuals who require additional medical screening while not excluding those who may benefit from exercise. Giving the personal trainer the ability to stratify risk, they are then able to identify if it is appropriate to assess and train an individual or refer them to a physician for medical clearance by administering yes or no questions related to the signs and symptoms associated with CAD, orthopedic concerns, or a diagnosis by a physician. With the assistance of the positive and negative risk factor table, it is then possible to categorize clients as low, moderate, or high risk. A low-risk client is asymptomatic with no more than 1 positive risk factor. Moderate risk clients are also asymptomatic with having 2 or more risk factors. High-risk clients are those with signs and symptoms of cardiopulmonary disease, known cardiovascular disease, pulmonary disease, or metabolic disease. If a client meets the criteria for an HDL-C level of 60 or higher, it is able to cancel 1 positive risk factor due to the fact that an HDL-C level meeting criteria is a positive influence on the client's body. With this table, risk stratification can be effectively broken down into the various risk levels and further into the recommendations for medical examination and graded exercise tests before exercise, as well as if supervision is required of an exercise test. With low-risk clients, there are no restrictions to moderate exercise, which is 40 to 60% VO2 max, and vigorous exercise, which is greater than 60% VO2 max. With moderate risk clients, it is not necessary to have a current medical examination and exercise test for moderate exercise. However, it is recommended for vigorous exercise levels. Physician supervision is not recommended for submaximal testing, but is recommended for maximal testing. For a high-risk client, it is recommended that a medical exam and graded exercise test be performed before exercise begins, along with the supervision of both submaximal and maximal exercise tests. For a low-risk client to begin working with a personal trainer, they must complete their client consultation, screenings, and other various forms and agreements. The trainer should inform this client of any preparation for their fitness assessments, such as the duration, cost and content, what clothing and/or equipment is going to be needed, and to avoid strenuous activity 24 hours prior, along with avoiding caffeine, tobacco, and significant food portions for 2 hours prior, as well as to not consume alcohol within 12 hours of their session. During their day 1 activities, they may begin an unrestricted exercise program of moderate to vigorous activity without a doctor's advice, since they have only one positive risk factor at most. Moderate risk clients may continue to finish their client consultation, screenings, forms, and agreements as well. However, this category of clients may only partake in low to moderate exercise without gaining clearance from a physician. It is possible to continue with submaximal exercise testing, but the client will need supervision of an MD for any maximal exercise testing. The personal trainer should provide the client a physician's referral form in order to obtain the necessary information about health status, physical limitations, and restrictions in order to properly design and implement a program for this individual if referral is needed. High-risk clients may be very limited in their day 1 activities due to the fact of having signs and symptoms of cardiopulmonary disease or having known cardiovascular, pulmonary, or metabolic disease. It is recommended that these clients be referred to a physician for both moderate and vigorous exercise levels before a program is designed and initiated. Just as with moderate risk clients, the personal trainer should provide a physician's referral form to obtain the necessary information regarding this client. These clients can, however, work with the personal trainer to complete their consultation along with any forms and agreements while awaiting clearance from their physician. I've also included the references used throughout this presentation as well. Thank you for listening.